Hi, I am Dr. Nalini, consultant pulmonologist. On the eve of World Asthma Day, I would like to share some important points on asthma. Now, the moment I say that they have asthma, many of my patients feel very anxious or apprehensive. In fact, the real fact is that we don't have to worry about that. Asthma is a very common disease, and many of the patients, in fact 90 to 95% of them, can lead a very normal life with good asthma treatment plan. So let us see what exactly happens in asthma. Now we know that for our respiratory system to function properly, we need two lungs and the breathing tubes which connect our lungs to the upper respiratory tract. These breathing tubes are like branching small branching tubes which fill up our lungs. So the problem with asthma is that there is swelling or inflammation happening in these breathing tubes. So what exactly happens? The breathing tubes get narrowed because of three reasons. One, the cells lining the breathing tubes get swollen. Secondly, the muscle in the breathing tubes constricts. Thirdly, there is mucus or phlegm production in the breathing tubes. All these lead to narrowing of the breathing tubes. So because of this reason, there are various symptoms that occur in asthma patients. Some people present with cough and phlegm, some might not have cough, they come with breathing difficulty, wheezing, whistling sounds coming from the chest tightness, breathing difficulty on walking, breathing difficulty in the night time, sleep getting disturbed, these sort of symptoms. So we do not prescribe different treatments for different symptoms. We need to understand what exactly is going on inside, and symptoms are a manifestation of underlying disease. So once we keep the disease under control, all the symptoms will come under control. Another important point here is asthma in children is completely sometimes a different presentation. It is difficult to diagnose because they might not have breathing difficulty or wheezing always. Sometimes when they are running or playing, they might not be able to run like their classmates. They might be having cough which might limit their activity. Sometimes they might have only symptoms in the night time like struggling to breathe, sleep getting disturbed, having upper respiratory allergies like snoring, mouth breathing. It's very important for parents to realize these symptoms, because if asthma is not treated in time, this can lead to retardation of growth in children, and also their academic performance and focus and attention in the school can get affected. So what can aggravate this asthma? When there is a genetic predisposition, sometimes types of asthma, when they are exposed to certain triggers, we call sources, like allergens, commonly the house dust. We think it's all pollution outside only, but most of the allergens stay indoors. So like dust, pollen, exercise, strong smell and smoke. So when we think about smoke, we think about only smoking, but other types of smoke, wood smoke, natural types of smoke that people use to chase away mosquitoes, agarbattis, all these things, indoor cooking using firewood, or in villages what they used to do before, all these things can aggravate asthma. Certain types of exercises, certain drugs also can aggravate asthma. So in a predisposed individual or a susceptible individual, when these triggers or allergen exposure is there, asthma symptoms can occur. How to know? One important point is how to know that our asthma is not under control and it is worsening. Two important things. One, more frequency of symptoms. Somebody who used to have once or twice a month is having symptoms regularly on a daily basis. Their daily activity is getting affected, their sleep is getting affected. That is a warning sign. Secondly, our rescue medicines, the inhalers that we use, the dosage and requirement has increased. That again is a sign that asthma control might be not there, and this might lead to an attack. Now coming to the treatment aspect, there is a big fear about using inhalers that I want to clarify. Inhalers are the best medicines for asthma. Why? Because the dosage in inhalers is in micrograms. All the tablets and syrups that we use contain in milligrams. So they are very minimal dose of medicines. They directly go to the area where the problem is there, act immediately, have best action, and very minimal absorption into the blood. So inhalers have best action, and they do not have any addictive qualities like nicotine. So there is nothing to worry about. Many patients ask me, can you write or prescribe anything else other than inhalers? But there is nothing as effective as an inhaler. In that again we have two types of medicine. One is a controller medicine, second is a rescue medicine. Like when we have fever, we take Crocin or Dolo 650 or paracetamol. So this temporarily controls the fever, but we need to find out the reason for fever. Is it a typhoid, is it a dengue, is it a pneumonia, and treat it. So the controller medicines are the ones which control the disease. Rescue medicines are the ones which temporarily relieve the breathing tube. So we need to know the difference and use them as per the doctor's advice correctly. And secondly, how to prevent asthma attacks, particularly before the winter starts, is very important. One important thing is, many people also ask, can we cure? Can you, if you prescribe the inhalers in couple of months, will I be completely cured? Asthma cannot be cured completely, but it can be kept under control with regular follow-ups. What I tell my patients is, at least thrice in a year you have to visit when your symptoms are regular, so that we keep modifying the doses. We might decide to stop or reduce the dosage or increase the dosage for the next 3-4 months depending upon the situation. Second important thing is to take flu vaccination. This is very important because infections, particularly viral infections, are a very important trigger for asthma, and it's important to control this source by doing yearly flu vaccinations. Regular exercise and not gaining weight is important, because in obese patients it becomes very difficult to control asthma, and asthma can become severe. So another important thing is not to smoke, to avoid exposure to any kind of smoke. With all these things and taking care of all these things, we can have a very good asthma treatment plan and keep an asthma under control and lead normal lives. Thank you.